In this video, I'm going to discuss some of the most common treatment options for prostate cancer. We do have additional treatments that are being developed every year, and so it is important to keep up to date. I will also go into more detail regarding each treatment options in follow-up videos, so make sure you subscribe and follow the discussion and comment section for links that I will be putting up in the near future. Prostate cancer treatments are put into 6 broad categories generally. The first one is something called watchful waiting. This is when we diagnose the cancer but don't necessarily do anything about it or even monitor it because the patient may have other medical problems that they're dealing with that take precedence, and the cancer will not harm them in the near future. The second option is called active surveillance. This is typically reserved for very low or low risk types of prostate cancer. Because prostate cancer is a slow growing cancer, we can sometimes monitor it, and active surveillance allows us to do that by doing certain tests such as PSA, imaging studies. We may do genetic testing if available, and we do routine physical exams. If we see that the cancer is remaining stable, we may be able to continue with the active surveillance, or if we see that the cancer is starting to progress and become more aggressive, then we can introduce definitive treatments at that time. The hope of this form of observation is that we do not over-treat patients. Some patients may be very young, and definitive treatment may cause side effects that will negatively affect their quality of life. Or the patient may be very old or older, and definitive therapy may not be needed in those cases, and the cancer may not ultimately harm them. This is going to be a joint discussion and decision that's made between the physician and the patient, and all the risks have to be discussed. Next, we fall into the definitive treatment category. We have radiation therapy. This comes typically in 2 forms. One is external beam radiation, and one is internal beam radiation or brachytherapy. These are the seeds that you may have heard of. Both forms of therapy involve radiation being used to kill the cancer cells, and both have certain side effects that have to be discussed. Some of the common issues with radiation is that the radiation beams may harm the surrounding normal tissues, such as the bladder or the rectum, and patients may experience symptoms such as bleeding from the rectum or the bladder and permanent damage to those organs. Secondary cancers can also develop, especially if we follow these patients for longer periods of time. Some of these initial nuances and side effects can be short-term, but some of them may be long-term and permanent. Therefore, a very detailed discussion regarding the side effects needs to be had with the physician and the patient. Next, we have surgical treatment. Surgery in localized prostate cancer is typically thought of as definitive and curative treatment. The prostate is taken out using robotic surgery in experienced hands. This is a very, very successful treatment option. Patients typically by 6 weeks after surgery know if their PSA is detectable or not, and if it's undetectable and the final pathologic report is favorable, then we may assume a definitive cure, but we will continue to follow the patient with PSA testing over a course of several years. The surgical option also does not take any of the other options off the table, such as radiation therapy, and therefore that can be kept as a backup therapy if needed. Patients who have radiation therapy up front may not be able to have surgery afterwards, as these tissues do not heal as well, and therefore the complication rates may be higher, and recovery may be also prolonged, and healing may be delayed or may not happen as adequately. The next category of options are things like high-intensity focused ultrasound or HIFU, where we use some ultrasound waves to kill the prostate cells. It is a lesser invasive treatment. but studies have shown that the recurrence rate for the prostate cancer may be significantly higher than the other treatment modalities. We also have something called cryotherapy available, where we can freeze the prostate and specific areas where prostate cancer was diagnosed, and hope that by freezing the tissue, the prostate cancer will die. Again, the recurrence rate has been shown in certain studies to be rather high, sometimes more than 50%, and therefore these treatments are not used as frequently and may be suited only for a limited number of patients. The last category is androgen deprivation therapy or hormone therapy. By giving a patient medications or shots, we bring their testosterone levels down to very low levels, and by doing so, we hope to starve the cancer from its food supply. This is typically reserved for patients who have higher grade disease and may be used in combination with radiation therapy, which may compound the side effects, or it may be used for patients who have had radiation or surgery in the past and their cancer came back and they require additional treatments. It is generally fairly well tolerated, but there are certain side effects that have to be discussed, and close monitoring is important. Now, I will try to add some additional information for each of these treatment options, and later on also try to go over some of the more advanced and newer treatments that are being developed and are available, such as proton beam therapy, cyberknife radiation therapy, and others.